There are many challenges associated with mammography and tomosynthesis in today's environment. The first one is really about breast compression. Tomography and tomosynthesis machines, a woman stands up, moves towards a breast machine, and her breast is put between two plates by a technician. Those plates are compressed, and this can be quite uncomfortable and for women. And an image is taken and it has to be reviewed, and this is done from 2 to 10 times. I think this in itself, this compression, many women find it very painful. Furthermore, if they have implants, like breast implants, the compression changes, in which they'll have to do potentially less compression, or different devices that are slightly curved. Again, these all contribute to a very uncomfortable user experience, as well as, I think, poor image quality. Furthermore, when a woman when it goes up to these machines, a technician really is the person that handles the woman's breast, manipulates it, puts it in the device, compresses, with a certain amount of force. These things do contribute to the fact that, at least in a screening paradigm, 12 to 15% of women do not want to undergo any screening whatsoever with regards to mammography or tomosynthesis, because they find it such an uncomfortable and unpleasant experience. Furthermore, when you compress the breast, I liken it very much to, if you think about a sphere like an orange or something, imagine all the fine structures that are involved in an orange. Look at all these fine capillaries and cellular structures that when you compress them, they distort. And that in itself, you can imagine, does not give you a proper image. And furthermore, this image is in 2 dimensions. It's not a 3-dimensional view, it's in 1 dimension, an image through. And then, they've tried to overcome this with tomosynthesis, which they've added, 15 degrees view or 20 degrees view on either side to try and enhance the vision around areas of interest. And that, in itself causes to increase time, but the breast is still compressed flat and distorted. And this really limits image quality overall. Now, if you can imagine, if you're looking for a tumor or malignancy or benign aspects, image quality is paramount. You want to be able to see something with absolute clarity. But with these images, it really does, all these aspects stack up in terms of degrading the chance or reducing the likelihood of seeing the areas of interest with clarity. You have a misshapen breast, you have one image, the image has to be at the right compression, the technician really has to view it to make sure that each image is correct, or it has to be redone. And this can take up to 10 times, which impacts workflow in terms of a woman could be there for 20, 30, 40 minutes even, getting their imagery done. And this impacts, the time that the person has spent there, but also the amount of patients a clinic can see, and lengthens wait times. And so this is all the multitude of factors that we're trying to overcome.